Hi everyone! So today my presentation is going to be going over mental illnesses, its effect on the brain, the way exercise can help to improve mental health, different statistics, and an exercise prescription for a specific case study that I created. So to get started, what exactly is the mental illness? A mental illness is defined as a wide range of conditions that affect a person's mood, thinking, and behavior. Every person to be diagnosed with one will definitely have a different experience and different symptoms, even if they are diagnosed with an alike illness. There are several different factors that affect the chances of whether or not somebody will be diagnosed with a mental illness, such as genetics, environment, and lifestyle influences. Genetics is if a family member has had a previous disease like that. Environment is a traumatic incident like serving in the military or living in an abusive household, and lifestyle influences are drugs and alcohol. There are 7 different types of mental illness classifications: mood, anxiety, personality, psychotic, eating, trauma-related, and substance abuse disorders. I listed specific types of mental illnesses. However, they are all equally important and take a significant toll on one's life. There are hundreds of different types of medications and pharmaceuticals for these issues. However, there are other ways to cope with them more naturally and holistically, like therapy and exercise. So just to kind of give you a brief overview, depression, bipolar 1, and bipolar 2 are all in the family of mood disorders. General anxiety and panic disorder belong to anxiety disorders. Paranoid, schizoid, and antisocial PD are all part of the personality disorder family. Schizophrenia is a psychotic disorder. Anorexia and bulimia are eating disorders. PTSD is a trauma-related disorder. And drug and alcohol addiction are substance abuse disorders. So the National Alliance on Mental Illness states that it's important to measure how common mental illness is, so we can understand its physical, social, and financial impact, and so we can show that no one is alone. Some country statistics that caught my attention were that 1 in 5 adults experience symptoms of mental illness each year. 1 in 25 adults experience serious mental illness each year. 1 in 6 youth aged 6 to 17-year-olds experience a mental illness each year. Suicide is the second leading cause of death among people aged 10 to 34. So on the next slide are some statistics about demographics, such as race, culture, ethnicity, gender, and sexual preference. For example, in the LGBT community, 37.4% suffer from mental illnesses. 48.6% of females suffer from a mental illness, and for non-Hispanic, mixed, and multiracial, 26.8%. So for this slide, it's prevalence by conditions. So it shows specific percentages on how common they are and how many people are affected by them. For example, for schizophrenia, it's less than 1% of the population, but that still equals 1.5 million people. And for anxiety disorder, that's the highest percentage, leading with 48 million people, which is more than twice the amount of people struggling with major depressive episodes, at 17.7 million people. So how does this affect the individual person? People with serious mental illnesses are nearly twice as likely to develop a cardiovascular or metabolic disease than the general population. In 2018, 19.3% of U.S. adults with a mental illness also experienced a comorbid disease, such as a substance abuse disorder like drug or alcohol addiction. Additionally, the rate of employment is higher among U.S. adults who have a mental illness at 5.8% than those who do not at 3.6%. This is because mental health issues oftentimes make it incredibly difficult to leave a comfort zone, such as a house, an apartment, or a therapy animal, without causing major anxiety. Now we're going on to the community. So mood disorders such as bipolar 1, 2, and depression are the most common causes of hospitalization for all individuals under 45, excluding pregnancy and childbirth. Also, $193.2 billion is lost every year in earnings because of serious mental health issues. Almost half of the Veterans Health Administration patients have a diagnosed mental illness or substance abuse disorder. Many adults who serve in military branches, such as the Army, Marines, Navy, Air Force, or Coast Guard, have traumatic experiences, and are later diagnosed with PTSD. This stands for post-traumatic stress disorder. PTSD is extremely common with over 3 million cases per year in the United States. However, anyone who is a victim to a tragic event or incident can develop PTSD symptoms later on. So as everybody knows, exercise is very important for individuals dealing with mental illness as it has many positive benefits. Exercise is vital for maintaining mental fitness and is proven to decrease stress, reduce fatigue, promote alertness and energy, improve concentration, and enhance overall cognitive function. So what does any of this actually mean? In just 5 minutes of aerobic exercise, the effects from mental illnesses such as anxiety issues will significantly decrease and stimulate relief. This will also stabilize mood patterns, improve sleep, and raise self-esteem. Exercise is medicine is by far my favorite saying because it's the honest truth. Speaking from personal experiences, I know that when I'm not having a great day or I'm feeling particularly anxious, exercising is the one thing that I can do to instantly improve my mood and overall make myself feel at ease. Like I previously stated, there are hundreds of benefits to regular exercise and physical activity, the most important being increasing the longevity of your life. Individuals that perform the recommended amounts of physical activity on a consistent basis will live longer than those who do not and live a more sedentary lifestyle. On this slide, I listed some different effects of medications that I had previously mentioned. These medications are not recommended for individuals with substance abuse disorders. So some of the medication types are antidepressants, anti-anxiety medication, stimulants, antipsychotics, and mood stabilizers. Antidepressants reduce the effects of depression, anxiety, pain, and insomnia. Anti-anxiety is used to help treat anxiety, panic attacks, and major fear. Stimulants are prescribed to individuals with ADHD and ADD in order to concentrate. Antipsychotics are used to manage psychosis, which are delusions and hallucinations, and mood stabilizers are used primarily to treat bipolar disorder, mood swings, and mental conditions with abnormal brain activity. Some common side effects from these pharmaceuticals include, but are not limited to, extreme fatigue, dizziness, trouble concentrating, nausea, headaches, blurred vision, and a lack of motivation or energy. These effects can make it very difficult for physical activity or exercise to occur. Individuals taking these types of prescriptions must check with their doctors or psychiatrists before presuming exercise. Some medications may also impact heart arrhythmia risk, increase heart rate, and raise blood pressure. So just a few more statistics dealing specifically with prescriptions and medications. 1 in 6 Americans use psychiatric drugs in their daily lives to function adequately and resume a normal life. Also, over 8.9 million individuals have a co-occurring disorder, which includes a mental illness with a substance abuse disorder. Specifically, alcohol is the most abused substance in America, with a total of 86 million offenders. I believe this is because it's the most easily accessible and inexpensive substance to obtain. Finally, tranquilizers such as Xanax and stimulants such as Adderall are the most commonly abused prescription drugs following opioids. Now I'm going to explain my case study and provide an exercise prescription because, as I said before, exercise is the best form of medicine. So with that being said, Brittany is a 30-year-old woman with a co-occurring mental illness of clinical depression and drug addiction. She has been addicted to drugs for 5 years and recently was diagnosed with major depression. She is receiving treatment for her addiction through counseling and therapy. However, she is finding it very difficult to treat her depression without taking medication or breaking her sobriety. She stumbles upon the Exercise is Medicine campaign and wants to know how she can get started. Brittany is not physically active and has not exercised in years. She currently has a BMI of 28. However, she used to be a competitive athlete in high school and throughout college. When she comes in for her consultation, you check her resting vital signs, and she has a resting blood pressure of 120/80 and a resting heart rate of 85 beats per minute. So for her exercise stress test, I would choose and conduct the Bruce Treadmill Protocol Test. It is a maximal exercise stress test that determines any risks associated with heart rate, blood pressure, and heart disease. I would also suggest a variety of aerobic exercises, resistance training, and flexibility stretches for Brittany's exercise prescription. For aerobic training, I would say that she should exercise to 40 to 60% of her VO2 max 3 to 5 days per week for a total of 150 minutes. This can include anywhere from jogging, walking, biking, running, or swimming. For resistance training, she should perform this 3 to 5 days per week for 8 to 12 repetitions per muscle group for 2 to 3 sets each. And finally, for flexibility training, she should do this 4 to 5 days per week with a combination of dynamic and static stretching until slight discomfort or tightness is felt. She can also hold it for 8 to 30 seconds per pose. For special modifications and precautions, her vital signs seem to be normal aside from her BMI of 28. Her exercise prescription is not only suggested for physical benefits, but also for mental health improvements. So she really wants to focus on her mental illness and making herself feel less anxious. She will not be prescribed any medications for her mental illness because of her drug addiction. She should be monitoring her heart rate and blood pressure consistently and accordingly before, during, and after exercise to make sure everything is normal. She should also start with a lower intensity exercise regimen and increase every week to build strength, power, and endurance. So finally, to end things, this is my slide of references that I used throughout the presentation. I hope you all enjoyed this PowerPoint and learned something useful about mental illnesses. Thank you for watching.